All right, we're reviewing kind of a passive thoracic extension laying on the mat. We're using a soft air-filled chi ball. First of all, you're going to landmark where your belly button is and then go about 2 inches above that, and then where that comes out your spine, that's where you're going to place the ball, laying down on your mat. The knees are bent, the feet are flat on the mat, and then you're going to decide what props you need. So Ava's going to put a small, she's got 2. If she puts the small pillow underneath her neck, that's actually pretty good because it's just a gentle extension of her neck, echoing the extension that we have in her spine because of the ball. If she puts the big block underneath her head, now we've taken away the gentle arc of the neck that we want. So we're going to choose to put the little one back there again. Most everyone will need something underneath their head. And then you decide maybe you need something underneath your bum, underneath your buttocks. If you feel that there's any discomfort in your low back, slip something underneath your buttocks just to bring the surface of the floor up to meet you. And if right away that takes away the stretch in the thoracic spine, then that's too big of a prop. So the rule is that this should just feel like this is a nice gentle stretch, no screaming of the spine, talking is okay. Once you're happy with your props, the hands can just simply relax out to the side. The knees could be kind of knock-kneed together so that you don't have to worry about them. You could also have a prop like a yoga block or a big pillow underneath your legs so that they're just relaxed, but we would not recommend having the legs straight out, as you're apt to arch your low back if we do that. So here we're just laying, the arms could be anywhere up overhead into more of a V position overhead, anywhere through here. Taking the arms overhead is a nice pec stretch. You would simply lay here 3 to 5 breaths and then you would move. So Ava's going to move. When you move, you just pressure into your feet, wiggle down a little bit, the ball moves up, you move down, and you put your props where you need them again. And you're simply just relaxing and slowly moving up the thoracic spine. Remember that there's 12 thoracic vertebrae and the ball's going to cover probably 2 at a time, so it's probably going to take about 6 moves to move up the thoracic spine. Once you get the ball in between the shoulder blades, this is a lovely area to stay and do some gentle arm movements. So Ava's going to do reaches, which is taking the arms up to the ceiling. Now when you do any of these arm movements, you really want to think that the movement comes from the shoulder blades, from the bones themselves. It's not an arm movement per se. You're trying to move the bones, which will move all the muscles that attach around the bones. So this is reaches. We've also got scissors, which is simply one arm going down and one arm going up. Nice movement of the arms. We want to be able to extend the thoracic spine and take the arms overhead. And then we've also got circles. We're going to do a bent arm circle first with the palms on top of the shoulders. And this is just so that you can feel again that the movement is coming from the shoulder blades, not from the elbows. Ava, if you can show what it would be from the elbows, it's not an elbow movement, it's a shoulder blade movement. And then Ava, make that bigger. Yeah, so now just bigger circles. So you could do bigger circles with straight arms as Ava is, which is more of a longer lever, so a little bit more weight, or you could keep the elbows bent, and of course your circles could be in both directions. Then we've also got one called Drape and Breathe, where you give yourself a big hug around, one arm on top of the other, as if you're going to try and hold onto your shoulder blades, and simply just lay there and breathe into the ball. And you could roll your spine a little bit one way, roll it a little bit another way, and there's really nothing wrong here that you could do with arm movement, just exploring arm movement, gentle spine movement with the ball. And we're going to take the ball up one more movement here. If you're doing a good job, you'd be taking about 10 minutes to roll up your thoracic spine, and we would be finishing in this instance here with the ball just where the thoracic spine ends, which is at the base of the neck. If we went any further up, that would be a different technique where we're taking it up into the back of the neck. So this one, we're just taking it up to the back of the neck and finishing there. And again, those arm positions, the reaches and the scissors and simply lying there are all options.